So the panelists and I have chosen anxiety and depression and eating disorders as three topics to talk about for tonight.
Anxiety is generated by stress, and that's kind of where we start. I like to use this kind of formula for stress. Stress is equal to pressure divided by resilience. So, it's kind of, if you think about just an example of like, if I have a copper sheet or an iron sheet and I use a hammer, which one is likely to crack or break first? Usually it's the copper, compared to the iron because of the resilience factor. So, we can take stress, but it's like we also have to have resilience to kind of balance that pressure.
First type of anxiety is just a general anxiety, but there's also generalized anxiety disorder that often gets diagnosed, and that often is when the anxiety prolongs in different situations. So it's not situational to one particular situation. It kind of happens all of the time, and that's most often the one that's diagnosed in teens is most often generalized anxiety. There's also social anxiety that's being brought up a lot for youth and teens, especially since the pandemic. We've been out of social situations for so long that teens are having a hard time interacting with their parents, their peers, their community. So we do see a lot of social anxiety when it's difficult for them to interact with their community and others around them. So those are the two that we often see in my practice, is the generalized anxiety as well as social anxiety.
Throughout my mental health journey, I've become a big advocate for treating symptoms when they're mild to moderate as opposed to severe. Secondly, I will say that anxiety was so commonly brought up in my book. So many of the people in it said that they have experienced anxiety at some point in their life. And I think that one of the biggest things to consider is that if you're a child, bullying is often a source for a lot of people's anxiety. And that is something that came up in my book. And I think that I experienced my anxiety has been a lot of social anxiety. Ever since I was a small child, I was extremely bashful and would shut down in social situations, didn't have a lot of friends, and also had difficulty with social reciprocity, for example.
If I want to compare, let's say, depression to diabetes, for example, in diabetes, one organ in our body has a problem, which is pancreas. In depression, brain and the brain chemicals are out of sync, which is what leads to depression, is how we understand.
Mental health challenges can happen to anybody and everybody. And number two, that healing is nonlinear, and that what works for one person may not work for another. And you may not find what works for you in treatment number 1 or treatment number 10 for that matter. But it's just a lifelong road that you have to keep on going on, rather than seeing it as a problem fixed type scenario.